Your drug might cost less than what your copay is, and people don't talk about that often, right? So when you go in and your drug costs $4, okay, and your copay is $10, then they're going to tell you your copay is $10. And sometimes if you're at a good pharmacy, they're going to say, hey, you need to pay $4 because that's all it cost us for this medication. And then the individual gets really upset with the insurance company and doesn't understand why the insurance company is charging them the $10. It's not the insurance company taking the money, it's the pharmacy if they charge them the $10.
Welcome back. Another episode of Healthcare Stories with Healthcare Henry. This one I'm very excited about. We have Heather Lacy, who is, to me, one of the more interesting people that I've seen in a while. I think it's always interesting to see someone who has worked in the insurance space and then spent some time out of it and is willing to come back and really thoroughly explain to us what it is that we're actually seeing. So Heather Lacy, thank you for coming.
No, thanks so much for having me on today. I'm excited to dive into the details today.
The details. Okay, well, let's get right into it. You worked in insurance for how long?
Over 20 years, about 21 years.
What exactly did you do so that they have a point of reference?
Yeah, absolutely. So I led business operations for two different large health insurance companies. And when I say business operations, I mean customer service, claims, grievance and appeals, Medicare enrollment, pre-authorizations, and I had global teams. So teams that were here in India and the Philippines. Mm-hmm. And then outside of that, now in like my professional realm, I'm trying to marry the experience that I've had in the past with more of a patient-centered experience.
Patient-centered experience is one of the things that I believe I'm going to go out on a limb and say this one here. It's one of the things that we're missing in the American healthcare system, right? And I'm going to also say, and it's really no fault to the people. It's been built around making money hand over fist, and that's what it is. And some of the things that we're experiencing now are a byproduct of that. My biggest question for you, and hopefully you're okay with this. I looked at AOC, and she drilled a major retailer who also owned the pharmacy, who also owned the insurance provider. She drilled them.
Yeah.
As someone who worked in the insurance space, would you find that to be, in your opinion, unethical, and why?
No, and let me tell you. So I worked for a large health insurer, specifically where she's at, like in New York. So
okay,
that's not news to me. And so sometimes it doesn't make it to like the headlines, right? But we would hear about stuff like that anyways. And I will tell you, sometimes people do things to take stuff out of the news as well. I'm not surprised about that at all. She's trying to speak to what she feels like the people in her area are experiencing. And so, I think for her, that's probably like what she feels like she's passionate about and what she should talk about. The people on the flip side of it, I think that they do try and engage to try and minimize the impact to them. But I'm seeing more engagement now than I would have seen even like 10 years ago. Like, I think it's starting to change.
When you say starting to change, what do you mean?
I think we're at a spot now where insurance companies are more open-minded to making those changes, right? Like, so at the end of the day, they're there to make money. I get that too. But at the same time, I think that they realize now that they have to take into consideration what some of these people are saying in order to still be a forerunner in the business.
Why do they have to do that when the barrier of entry to opening an insurance type of firm is so high and borderline impossible for anybody outside of them?
Right. Well, because if somebody says something bad about you, then they share it with like often 4 or 5 other people. Right. And you don't want that out there. You want to continue to grow your business. And if somebody experiences something good, then they're not as likely to repeat that information. So you want to address it when somebody is saying something negative, and they know. It's not like they don't know. So I can tell you, being on the inside, like, they monitor their social media just like any other big Fortune 500 company would. So as soon as somebody says something, they know within 15, 20 minutes that somebody is saying something specifically about them and what it is. and have an opportunity to mediate that.
When they go in and mediate that, is it just for public view, or is it something they actually want to change?
I would say initially it probably was just for public view, but
I
that's why
appreciate your honesty.
of course, right? And they're my customers too,
Yeah.
right? So I have to have these honest conversations with
Mhm.
these types of people because I feel like that was the missing link.
Mhm.
If somebody says something negative about your organization, you immediately want to be like, oh, I don't want people to say something negative. But at the end of the day, the better experience is when they go back and they say, hey, this company reached out to me and they made it right. And this is what they did to make it right. And that makes a huge difference.
I agree. I agree. But what about change though, right? Like, and that's where it's like when you say that you think that they're changing. And this is where I go to stories like, I don't know if you're familiar with Dr. Elizabeth Potter, and her story is she is a doctor. I don't know the state. I think it was Texas. Maybe she's a surgeon. But anyway, she does these procedures on women particularly, and she has procedures that are essentially canceled in the middle of the procedure. And the insurance companies are calling saying, hey, either we're not going to give you this authorization, or procedures are being moved to places where they're comfortable to have them done. It's like it really takes away the choice from the doctor and the patient. When I see those stories, and they keep popping up now, of course, it's like, I don't know if I'm really seeing change, or just we're just talking so that people can kind of know that we're at least looking into it, right? So are we really getting change? And if we did, like, what does change actually look like?
Right. So it's a really interesting short story that you shared. And it kind of strikes me as strange because, I've worked for one insurance company where there was a lot missing, right? And one where I could see some changes were happening. But I will tell you 9 times out of 10 that it wasn't the insurance company trying to do the wrong thing. Okay.
I agree.
So,
I agree.
these were people that when they were working for me, they were making $14 an hour. Okay. Answering the phone or processing a claim. And, I'd have a doctor calling me saying like, you're holding on to this claim for $75,000. You're just trying to make money off of it. And I go and talk to the manager and the supervisor, and like the supervisor, honest to God, make a mistake. And so it's always interesting hearing the flip side of it, right? And the reality of what the situation is, because it wasn't always what is put out there and what people are saying. I think we always think of them as like, oh my God, they're the big bad guy. And they're just trying to, and I'm not trying to say that there aren't some doing that. Some of the larger health insurance companies definitely lend themselves to be more on that side of things. But some of the smaller ones that I've worked with, a lot of times there's just not the right leadership and the right areas and the right oversight to what needs to happen. Because I can tell you that some of them, if they had a Dr. Potts situation, that definitely would not be okay.
When I look at when you say small insurance, and I'm going to say particularly here in Georgia, there's one that came in, did a pretty big marketing campaign, signed a lot of people up, and a lot of the promises that they told people just won't hold true. And the reason for that is because they have a hard time paying vendors in a timely manner. I see that actually more often with smaller insurance company, and small is very relative, right? Mm-hmm. Versus like your big Humana's, Blue Cross Blue Shield. Like to your point, they don't do it. But I feel like the smaller ones are holding on to that purse a little bit, a little bit more, and it's causing other clinicians to say, well, we're actually not going to be in network with them anymore. So you have a ton of people who've signed up for those insurance companies, and now it's like, well, what do we do? How do we put more checks and balances in place so that we can stop this type of behavior, so that the people who do sign up for your insurance companies are at least going to get what they were promised?
Right. So I think there has to be some upfront honesty with that, and like vendor relations, vendor management too.
Sure.
So is the expectation going to be that you get paid in 60 days? Is the expectation going to be that you get paid in 90 days? Mm-hmm. And for these smaller organizations, some of them do have the ability to go out and come sit and meet with you and talk about what that looks like, right? Mm-hmm. Because they're paying these people to do the service for them because they can't do it themselves, whereas some of these larger ones they can, or they have the capital to float it. But I think that you would be surprised what you can do and what you can set up in situations like that so that you are paid appropriately, so that it doesn't end up being an issue.
So you mean that right now, if I have a insurance company that owes me $500,000, a smaller company, I can call them and say, we need to sit down and have a meeting about this, and I expect them to come to the office and talk to me?
Yeah, believe it or not, yes. And it's kind of like, it's interesting to me because the squeaky wheel gets the grease, and you're laughing, but like, I've seen this. I had a $30 million budget, annual budget. And so, you want to make sure you're paying attention to all the important things, right? But I tell you, the squeaky wheel does get the grease, and it doesn't mean that like you can't push the way up the ladder. And interestingly enough, now when somebody has a healthcare issue, whether it's a personal issue or whether it's like a payment issue, because I have friends that are providers too, and they're like, oh my God, I'm not getting paid, right? What do I do? And I'm like, you have to push it up the ladder. You cannot be afraid to be that person, because it's your business or it's your money if it's singular for you at the end of the day. And like, you have to fight for yourself. And I use the word fight loosely, but you have to take responsibility for it and like make them be accountable. And then you have to decide, is it worth the business moving forward?
I think in the future, and I'm not saying that, I will say that there is one that owes me quite a bit of money, right? Let me just be honest with you. And I never thought to just call them and just say, can you come? But we have called them over probably 50 times. And it's like, they just don't answer or get back to you whenever they can. It's kind of one of those things where you almost have to like literally come out of network, because you're like, okay, well.
Yes. Yeah. And you have to tell them, I'm going to. And then it's like, oh God, no, really?
Well, then for us, it just didn't feel like that. It felt like, well, so what? Right. And that's why I say from my side, like when I see some of these things, I'm like, that's not what we're experiencing here for us right now. It really does feel like, well, if you don't want to do it, we'll find somebody else who will. And it's like, well, you'll do the same thing to them. And then we have to make a decision, right? Do we say something publicly? Right. And then that's where it gets sticky for me. And then the biggest thing is because companies that are smaller than mine can't afford that. No, that'll literally put them out of business. It'll literally put them out of business. Right. So it's like, I could not say something and they take that risk, and then I would feel bad about that. But to your point, I will just make a call and see if they can just come in and sit down and we can discuss some type of agreement that works for everybody. I'm okay with that. For you though, what got you into this work? I asked that because you seem very passionate about the insurance side. So what got you into this work?
So I'll tell you, like, I think it's a series of a couple things that happened. I really loved working in the insurance industry and working on the healthcare side of it, from the part where I felt like I was able to make like meaningful change in the lives of people, right? So the day in, day out, like policy stuff is not fun. Having to deal with like CMS complaints that would come in, and those are very important things. But that's just like, pushing the pencil, having to do, the work that you have to do day in and day out. But touching the patients and interacting with the members are what made the difference to me. And I saw too many things happen too many times. And then also things in my own personal life that occurred. And I'll just share a couple examples with you.
Sure.
So my son was in the hospital for an extended period of time, 12 weeks. And in that time period, we actually went up to Boston, and I ended up just being his sole caretaker. So it was just me. I was not working. And that was very hard. And the amount of people that are doing things like that in the country, it's crazy. And we don't really look at that. And that happens all the time, like in the organization that you're in, in hospice, where people are taking care of their parents or their family members. And shortly after I came home, my dad became sick, and he had to be in the hospital, and he went in 2 different hospitals. They couldn't figure out what was wrong in the first hospital. Then he had to go in another hospital 2 weeks later, and there was like an aha moment. Oh, we missed something, but there was no responsibility at the first hospital at all. And so it was like, how did we miss that? And they're not going to want to go back and take responsibility for it, because it's a financial responsibility. And then people will talk about suing, and I'm not even interested in that.
Right.
So I will tell you that, coupled with when I was in the insurance industry and I heard things where people would be on the phone with customers, and it would be elderly people, and they would talk to them like, just, I don't want to say like dogs, that's a horrible thing to say, but like, they wouldn't talk to them with the respect they deserve. And it made me think of like my grandfather, who got the key to the city at one point in time. He owned his own business with 5 stores, was very successful. And I just felt like, oh, like he would be like an invisible customer, an invisible patient to these people. And so what does that look like, to somebody else going through all of these things? Like, that's my family that dealt with that, but there are people calling every day with issues like this. So I thought about, how can I take this information and like bring it back, not just from like surveys, because I filled out a lot of surveys, and you know about what all those surveys are, and they just end up on people's desk. Nothing happens with those surveys. They look good and they get printed, but nothing really happens at the end of the day. So bringing the real stories and the real information, and actually sharing that information and making it applicable to how we change the face of the business. So I'm on a real mission to just like change health insurance, change healthcare, the culture behind it. I know there's a few other people in this space that are trying to do that now, but I'm very passionate about that.
You are what I would consider a part of this sandwich generation, more or less. How old was
Yes.
your son? How old was your son when he was in the hospital for an extended stay?
Yeah, so he's 12, right? So then my
Oh,
parents are
he's young. Okay.
he is, but my parents are in their 70s, and I also
Mhm.
have 2 adult children. So I am in that kind of sandwich
That
generation.
sandwich
Because I had my
generation.
grandparents I was taking care of, and my parents, and then my son, and I have adult children. So I'm definitely right smack dab in the middle of that.
How does it feel?
It's a lot of pressure, because it's like taking care of myself in addition to my children and my parents. My grandparents have passed on, but having to deal with their healthcare issues. I sat next to their bedsides too. It's a lot. And to think about people that don't even have anybody to help them at all. I have a neighbor down the street that I ran into in Walgreens about 4 months ago, and she's screaming like at the pharmacist because she thinks they don't understand her. And so I have to come up and like, try and explain that information for her to the pharmacist. And, I ended up taking her home that day, but it's just another person, and it's another, like, she's not my family, another burden, because I have this feeling that I need to take care of other people. But it's hard. It's really hard. And I don't think there's a lot of programs out there, or enough programs out there now, for people that are dealing with that kind of thing.
Do you think that's on purpose?
Well, that's a great question. I mean, there are new companies coming out now that are recognizing that, and that are offering it like in benefit packages, but it's very, very new. So, I haven't felt like that it is on purpose, but that's definitely a different way to look at it. Yeah. What makes you say that?
I ask because I look at, I'm in America, you're in America, of course,
Yeah.
right? And I look at what's been happening over the past, I'll say, year and some change,
Mhm.
right? And trying to truly understand, when I see a generation of people. We used to have this thing, well, we still have it. It's called structured family care. Are you familiar with that?
Yes. Mhm. Yep.
So with structured family care, a lot of people who are on Medicaid, they're caregivers that, like, to your point, they cannot work. Like, they
Right.
literally cannot
Right.
work.
Yeah. Because then you don't
So that
qualify. Yeah.
it's literally, so for people who do qualify for Medicaid that can get that program, the person can then be paid by Medicaid to take care of their loved one. It's probably the best program America has, in my personal opinion.
Mhm.
And I see everything from beginning.
Right.
IVF, children in the hospital, everything. It's probably the best program that we have. When they started taking Medicaid from people, that's the first thing I thought about. I didn't think about
Yeah.
doctor's visits. I didn't think about emergency visits. I literally thought about
Those
the
people.
millions of people who were set up on that program, who would now still have to take care of their loved ones, but they don't have any money, right? That's where I'm. And when when people start saying to me things like, well, this is just the way it is, or this is not sustainable forever, and I'm always like, well, it might be the way it is, but why does it have to be this way? Why? And for me, I'm not a politician by any means,
Yeah.
right?
Right.
At all. But I do feel that America is in a weird place where people are having to choose between one side which is more religious based, and the other side which is more people should be able to do whatever they want, and we don't really have a good middle ground,
Yeah.
unfortunately. Unfortunately.
Yes, that's very true.
Yeah. But when I look at, particularly with women, and I'm just interested to see as an insurance provider, right? When they say things like we're going to provide or not provide ways for women to, or make it illegal for them to get abortions, or we take away a lot of their jobs. Women have lost over 500,000 jobs this past year, over 500,000 jobs just in one year.
Sure.
How does the insurance industry going to help with that? Are they going to provide more jobs for that? What do you see happening with that? Because if they don't have jobs, if they're not married, they don't have insurance, what's going to happen next?
Yeah, it's a really good question. There's something that insurance companies do provide, and this already, right? Like when it's going to save them money, I see it like this: when somebody's about to have a baby, or after the baby, to make sure that the care happens. And so I've thought about that since I haven't been directly working, for an insurance company for several years now. Like, what are the opportunities? Because I don't really see that there are a lot of opportunities provided by them, which could probably actually save them money in the long run if they did provide those kinds of programs. But that one stands out because it happens so often. My daughter recently had a baby herself too. And so they're calling her over and over again. And she doesn't even want the help. She's a young new mom. And then I'm at the point in time in my life where I probably would appreciate the help. And there are different things that could, help me as well. But that's not something that you traditionally see offered, any kind of outside services or help, because sometimes they'll connect you to programs, but that's not something that they really key in on. You are driving home a really good point.
With Medicaid being, or the lack of Medicaid being expanded in so many states, right? And you being on the insurance side, what do you believe will happen next?
So I mean, it's been limited so much lately too. So I see that people are going to look at certain programs and see where can we capitalize on certain programs, right? So when I say that, there's incentives behind things all the time. So we incentivize them to go even to the dentist. We incentivize them to get their annual visit at the doctor, right? They get $25 if they're on Medicaid in the state of New York, with if they go see the doctor with certain insurance programs, right? Depends on the insurance program.
Really?
Yes, I know, because I worked for insurance companies that sent them out. Yeah, absolutely. They're incentivized. Go ahead.
We did a story on a gentleman who incentivized people to come get Medicaid checkups.
Yeah.
They sentenced him to jail.
Yeah. No, well, a doctor can't incentivize people to do that.
He wasn't a doctor. He wasn't a doctor. He was more of like he had a clinic. This is super interesting now. So he had a clinic. It was family run, Medicaid. And so he would give out $25 vouchers for people to basically come get checked, right? So they ended up calling him kickbacks and sending him to jail. But you're saying this is common practice.
It is common. I know Medicaid knows as well, because I've been on calls with with people working at Medicaid too. So it's not it's not specific to one specific insurance company where they do that. So where they want people to go, then they're going to incentivize them so those kinds of things continue to happen. That's where you're going to see some changes start to happen. But as far, dentistry will be one of absolutely the first things that does go. So that's like an add-on benefit, right? Your add-on benefits are the things that are going to be the first things. It's important for people to have an annual, so they'll keep, incentivizing for things like that. But if it's something that's ancillary, then you're not going to see people push for people to go to things like that. That'll be the first thing that gets dropped in my mind.
Insurance and AI. What does that look like? Will they start denying claims left and right because of the lack of the human factor?
No. So the funny thing about health insurance companies is they are so behind the times. So I will tell you, at the ones that I directly worked for, one of them was using the same processing system from 1975, and they changed. So they changed it in the early 2000s. Another
Okay.
one that I worked at, they are so behind the times. Now, they do try to prematurely, and I don't see this, it's just the ones I worked at, the ones that I've been doing consulting work with. A lot of people have felt the pressure from the AI push, right?
Mm-hmm.
And so they've put in IVRs, like interactive voice response systems, a little prematurely in some cases, and had to back them out. You have Medicare members, and they're calling and they're just wanting to press 0. They don't understand what it is that the person's asking, or rather that the automated system's asking them. So I think that they are actually jumping too soon on the wrong things in some cases. But it's interesting. I do see a lot of conversation going on about that, but they, like I said, they are the most behind the times group of people. And it's so expensive, right? So a lot of the work is outsourced in large health organizations.
Correct. Yep.
So, I'm sure you heard me say that, like, some of the teams that I had were in India and the Philippines, and that's at most of them. So I think people feel like that, oh, I'll get away from that, but it's at almost every mid to large size health insurance carrier now.
Okay, so now this is even more interesting. One of the things that I'm going to say quoted, more or less, is that I don't think that AI is as advanced as people think it is, right? I think that we're very behind. I don't think it will take jobs like people think. And I look at what you just said, so we have a tech portion of what we do here at the hospice, and we'll talk about it a little bit with you because you're in the insurance industry. Yeah. And a lot of what we had looked at early on was outsourcing. And we looked at AI in terms of helping build it. We looked at outsourcing, and we looked at American engineers. And what we found was that from us because we got like people who say, hey, I do the background tech for Delta. And I'm like, what? In India? Yeah. They're not kidding. And so I'm like, okay, so everyone does outsourcing. So this is something that's been going on for years. And you can confidently say people don't have to worry about losing their jobs tomorrow.
Yeah, well, I can. Yes, absolutely. Where AI like really shines right now, especially in the insurance and the medical space, is like where people are like typing responses back that are canned, and where you and I are probably using it too, right? So you're sending an email back to a patient, you're taking the PHI out of it, but you want to make sure that the information sounds, it flows well, and that the information is concise. So those are the good opportunities to use it. Or you're writing a letter that's going to be sent out to 100,000 members, and you want to make sure that the letter is in the right format and that it contains all the information that CMS required in this reg. So you plug the reg in there. Things like that will make it a lot quicker, but you have to still check it, because I'm still having to check it for what my information says on there right now too. It's really good for creating workflows and improving processes, but from the insurance standpoint, we're just really not there yet.
What about, so for me, when I see AI the most, I see it in dictation. So like people are able to be able to help them take notes. That's what I'm seeing the most change right now, and being able to get someone to be able to talk, and then we can speed that note up because we got it in the back end. But to your point, they still have to edit every single note, right? They can't physically just turn that note in. A lot of them make no sense, but they at least have a way to outline what they did at that visit.
Yeah, and the same thing will happen on the medical side of it too, right? So, I had a group of nurses under me that did all the pre-authorization. And I will tell you, and I know you're seeing it like with things that get denied, sometimes it's like 2 or 3 words, and that's why something got denied. So you'll be able to say, like with procedure code 1234 and diagnosis code 123, every single time, make sure that you have this add-on procedure code to it. Not procedure code, but modifier, whatever the situation is, but you still got to go back and check it. Because if it's something that's like 1 or 2 words off and that's what makes the difference, then you want to make sure it's in there.
So now I'm interested again. So I'm going to tell you what we built from your perspective. I'm interested to hear what you say. You're familiar with what an EMR system is?
Yeah.
So one of the things that we built is an EMR system. And the reason that we built it was because when we get a hospice patient that have different concentrations or different disciplines, they're all over the place. So we got to go here to get a note, go there to get a note, go here to get a note. And a lot of times when a patient goes and asks for a note, it can be a day, it could be a week. I've seen it take up to 14 days to get their notes back. So what we've done is we've built something where the patient actually owns their notes. They have control of their notes and they get to keep them on their phone.
That's fantastic.
But thank you.
It is.
But it goes a little bit deeper because my approach is you are not the consumer if you're not the one paying. So a lot of EMR systems are being paid by physicians or us hospices or hospitals. And so it is in the EMR's best interest to satisfy their customers, which are the clinicians. Mm-hmm. This one is built entirely for the consumer. And what it does on the back end is that it does have AI. So when you go in and you don't have a patient advocate, you can record that conversation and we'll give you questions to ask in real time.
Oh, that's fantastic. You can market that.
Okay.
That's fantastic.
That's good to know.
No, I'm serious. That's really good.
I'll send you the beta for it as well. So yeah, it's called Precious Path from your path from the beginning to the end. And so we want to give it for kids. And again, I have a 3-year-old. He's 4. Yeah. Turns 4 April 9th. He's about to be 4. He turns 4. Sorry. I have a 3-year-old that's turning 4 in April. And when I wanted to move his doctor, they gave me 300 pages of information because no pediatrician's information EMR ties to another one. There's no API to connect them. Yeah. So we were stuck. And I'm like, okay, well, do I really want to go through all of this? Right. And so it stopped me from changing him, even though maybe I should have. But now I'm like, this could be interesting. From an insurance perspective, though, what does that look like?
Well, so from an insurance perspective, it's a little bit different than, sorry, I want to stop really quick if that's okay.
Go ahead.
No, the reason why it's just so my son I'm stuck on what you said because my son just asked me for his medical records. He just went to the pediatrician the other day. And this is so valuable what you're doing because he wanted all of his medical records. Now his medical records from his pediatrician are electronic. Now it doesn't have any of his stuff from Boston. It's from his pediatrician here, right? Correct. It doesn't have any of his orthopedic history at all. And then I was sat there with him and although it was electronic, he kept asking me so many questions like, well, what does this mean? And I don't understand why the doctor wrote this because we just went to the doctor this week. So, I mean, that is so valuable to people that don't have patient advocates. I love that. I think there's a huge opportunity for that, like in the market for individuals, but having to explain where that works. I mean, I think there's so much opportunity for it. Well, you were also asking, like, as far as from an insurance standpoint, like, how does that work in the insurance arena as well? There's definitely dictation on the doctor side of things. There has been for years, right? And doctors used to walk around with like little recording devices and give them
scribes.
Yeah, exactly, and give them to their their assistants. But on the insurance side, it absolutely could be a valuable tool too. And I think there's an opportunity to be sharing notes like audio type notes, right? Because when they are audio is spoken, I think people are still kind of weary and they're like, oh my gosh, like it's got to be all written down. But when you have to set up like peer-to-peer reviews, and sometimes those can take days, you're talking about a patient waiting like 14 days to get information. Sometimes when we have peer-to-peer reviews, those can take 2 or 3 weeks. And that kind of stuff will, it reduces the amount of time that you have and claims get delayed on and on. But there's real opportunity, I think, to use it on that side of things too.
And I think for patient outcomes, to your point, if you're talking about a cancer patient who's trying to get a second opinion, 2 or 3 weeks could be life or death.
Yes, absolutely. Absolutely. And, I want to say, oh yeah, like we could just move towards it. Everything seems like it has to get approved at the next level for stuff like that. But that's stuff that's really interpreted more at like an actual organizational level than interpreted at like a CMS type level.
That's interesting. So for you now, you've been in insurance, and let me be clear, it's very rare to get someone from your side to talk publicly.
Yeah, I know. I understand.
It's like almost impossible. Then every time you ask them a question, it's like, okay, at a certain point, I'm like, this isn't going to work. Don't worry about it. I'm going to scratch it because you aren't answering any questions. But thankfully for you, you are answering questions. Yeah. So it's fantastic. Where do you see everything going in 5 to 10 years? And should people be afraid?
No, I don't think people should be afraid. I think people should be ready to embrace it. But I do think that things are going to move more auditory. And because we are already moving in that way now, right? I talked about like with the IVR piece of it, people are wanting to do and are more accepting of that kind of thing now too. So I think that we'll see more of that across the board where you have access to your records. People can read you your records, not just people like where you can go online and see them. You have the ability to have somebody like, interact with you from that way too. But I also see where there's situations where they're starting to provide patient advocates too in certain avenues to explain things, right? And when I say that, I mean it's more like to explain what a new policy would mean to somebody that's like joining. It's more of a marketing standpoint, but I see it where it could be used in other areas too. So explaining up front, like, okay, what does it mean to somebody that is 65 and they're, going into Medicare, and what are the differences if I accept traditional Medicare versus if I accept, Part C plan. Those kinds of things are available right now, but there's an opportunity to use them for other types of learning too.
Someone who's in insurance, right? I struggle with the Medicare Advantage plans, right? I genuinely don't understand them. People are constantly being denied treatments.
Yeah.
What's your take on it?
There's a lot of confusion. I just read something, I want to say yesterday, where they're talking about like forcing people that don't choose Medicare. Like it's confusing in the beginning, right? They're going to put them on a Part C plan, an Advantage plan, rather than placing them in traditional Medicare so that they're like not left with something. It's very confusing. They offer for you to go sit down in the Social Security office and meet with someone, but I think that even the individuals that are explaining it are sometimes don't understand what it is that they're sharing, and that's a little bit scary. It's really important to have somebody that can explain to you what the differences are and what it means if you don't sign up, right? So I have a family member who didn't sign up for Part D. And although it's very small, right, the little teeny amount you'll pay every single month once you do sign up, but people don't realize that. So you turn 65, you go on Medicare. Oh, I'm not on any medications. I'm young and healthy. I run all the time. I'm just using this as an example. And then at 70, now I'm on a permanent medication that cost me $100 a month. And now I'm having to go back and pay $5 a month for every single month that I didn't sign up at the time that I turned 65. And it kind of sounds crazy, but that's really how it works.
I didn't know that.
Yes, absolutely. And so because we don't do a great job explaining that when somebody signs up for it, then those are the kinds of issues that they run into down the road. And it just sounds so crazy. And then they're like, what else do I not know? What else do I not understand? And I wish there was more opportunity for us to share that information. It's kind of a scary thing for people.
I'm actually a huge proponent of Medicare Part D. D as in dog. I've been saying that for a long time. And what my grandfather passed last year, and he was a cancer patient. But before he passed, he had a medication that would have been, I won't say the name of it, but it would have been about 15 grand a month.
Yeah.
And with Medicare Part D, it ended up being like 2 grand a month, right?
That's great.
So that probably extended his life, if we're being honest, right? So no, I'm with you 100%, and I've seen it firsthand. Do you think Medicare is confusing on purpose? And the reason why I ask, there was a doctor Dr. Z, I believe he was he in Baltimore? He was in Baltimore, Maryland. And he ended up getting cancer. Now he's been a doctor for the past 30, 40 years. He ended up getting cancer. And because he didn't actually know how to sign up for Medicare, his insurance lapsed, right?
There you go.
It's like, and I'm reading that story. I'm like, this is actually insane, right? We have a problem. Now we have a real problem. Do you think it's like that on purpose? Why is it so complicated? Why can't we make it so that a senior can pick up a pamphlet? Hey, here are your options, A, B, C, D, and you pick and go from there. Why isn't it like that?
Yeah, I don't know why we don't go back and just change the way that it is to begin with, right? Like we have a 3-month look back window and then a 3-month window to go to here. And then during open enrollment, then you only have between this date and this date. And if you don't, the reason why stuff was set up like that is so that people on the back end that are actually processing it, because it's not the government processing it. That's that's another thing is some elderly people think that for some reason the government's the person processing their claims when they go on Medicare. It's another health insurance company, right? You might
Say it
be
again.
on the same health insurance company when, your whole life. And then when you go on Medicare on the same one in some states. So it's interesting that happens. And I feel like originally it was set up to benefit the individuals, or that rather the health insurance companies that were processing it, because it hasn't been around forever, right? So it's changed in some ways where it's gotten better to where there are only a certain number of health insurance organizations that can actually like take it, but at the same time, it hasn't changed enough. The individuals that are taking it, like I think it's 17, I might be wrong now, actual traditional Medicare carriers. And then for everybody else that falls into your a 1-star, 2-star, 3-star, 4-star, 5-star, there are very few of those plans. Then you can decide which kind of health insurance company that you want based on the stars, right? But that can be confusing because somebody's like, oh, that's a 4 or 5-star plan. That's the plan that I want to go on.
Yeah.
Yep. And that, because somebody's going to equate that with like a hotel, like that hotel is a 4-star plan, but that 4-star plan may not have your doctor in it. And that 4-star plan may have horrible customer service. I worked for a plan that had a 1-star customer service and had to turn it around. It was bad, but, and they did, but those things are still very confusing. And I feel like that we're in a state of change, like I said earlier, where people are ready to start making those changes, and that we have more people that are engaged, that are willing to do it. So hopefully we'll start to see more of that happen.
Do you think that, and I know we touched on it a little bit, but it's something that's it's super important to me that I want to get your opinion on this.
Sure.
When a major retailer who also owns the pharmacy, who also helps negotiate the prices for medications, also owns an insurance company, right? Do you believe that some of these things should be separated, or that you think it is better workflow for or it can provide better outcomes for the patient the way that it's set up?
I think initially that's what the desire was. Do I think that's always what's happening? No. And I'm not wanting to pinpoint on any specific, plan themselves.
I didn't say the name. Yeah.
No, but what I do want to share is I think that some of them, you'd be surprised, are more open to hearing about it than others, because I think that they come at it from a point of, we are handling all of this stuff together. Like there's a big circle here. So when the provider sends the information to the insurance company, it's written exactly the way that it needs to be processed, so the claims processed, and it's processed timely. And it's the same pharmacy. So the pharmacy is able to process the claim quickly at the pharmacy too. But they don't see the gaps that happen in that process too, because they're so blinded, I think, by sometimes that we own the full process to where the breakdowns or the silos occur in between those.
How could we fix that?
I think to fix it, it means like having some sit-down conversations, some big conferences. It's going to have to happen at like the level where it's with, starting with like CMS, starting with like lobbyists. It's going to be more than just going to talk to one insurance company. Some are more open to it than others, but I feel like that when it's holistic, when you have medical centers, hospitals, you have insurance companies, real individuals that want to make a difference inside of all of these places, sitting down, having these conversations together, honestly, then we'll start to see some changes. Because I honest to God, don't believe anybody at the end of the day goes to work to do a bad job, right? But I will tell you, last week that I saw at one of the major health insurance companies out there, a guy put a post on LinkedIn, and he was talking specifically about how he failed his father. And I thought, wow, how sad. And he said, I will never let this happen again. And I don't think he feels like that, oh, I was just out to try and make money for the company that I work for, and that, you only own what you own. And I think that we're so narrow-minded, we go into it like, this is my part of the business that I own. And you don't think about how your part of the business is impacting all those other areas of the business. And that's really where we have to change the mindset, is like, how are all of these other areas being impacted by your one area, right? How are we all working together? Because right now it's just people are seeing it like passing the purse, right? I'm taking the money and putting it in this purse and taking it out and putting it in this wallet, and it's just staying in the same place rather than looking at like a holistic patient experience. What is the patient experience like at the end of the day?
Do you believe in healthcare companies having healthy competition?
Yes, absolutely. Yeah, I think they should. I think if you are like the only big player out there, then something's wrong. I mean, we've seen the same thing happen like in the airline industry where you just had like a couple big ones and then they kind of just took over, and then the government had to come in, long before you or I were around, but then it broke things up and made a lot of changes, and it made sense. I think if we continue to just have like 3 or 4 large operators, you aren't going to have the same lens as to when you have some of the smaller ones with different challenges out there. I think it's important to have the different ones. Absolutely.
Is it possible for your average person to start an insurance company?
Yeah, it is actually. So this is kind of exciting. So somebody that used to work for me, that was an employee of mine in a call center, moved on to a another health insurance organization, and he was pretty inspired. And he's gotten some backers behind him, and I can't believe it. But he's trying to start from the grassroots, like ground up, and build an organization. And I didn't think that would be possible, but what I've seen him be able to do with funding now is pretty incredible. And I think it's because people, like we're talking about before, are ready for the change. They want to see the difference. So people are like wanting to get behind people like that. There's people like Mark Cuban right now, just like stirring things up. And so I think other people feel more empowered to stir things up themselves too. And so they want to get behind people that are doing those types of things.
How much money would it take to start one?
Millions of dollars.
What's
like,
millions? Are we talking 2 or 250?
No. I mean, like a small one, like $250 million. And so it's not going to be somebody that can just go in at like entry level and start something like this. You have to have some major backing, and you're talking about very small, more self-insured type stuff. But I think people are wanting to move to more of a self-insured platform now too. And I think we're really going to move to a lot more of that in the next several years. And that's a real opportunity, which is where this person's going.
So what I think is going to happen the next, see things that I've been in hospice now, I'm 38, right? Yeah. So, and I really just got into healthcare about 10 years. But the change that I've seen in the last 2 years is far greater than change I've seen in the previous 8.
Absolutely.
It's happening so fast, so fast. This is my belief. This is 2026. By 2030, a very large percentage of people will actually be self-insured.
Yeah.
And what they will find is that, and this is what I believe, they are going to be willing to take the risk, which is the reason that they believe that they need insurance. And I'm not sure I disagree with this. I'm just going to say what I've been told.
Yeah.
Is that either because I get cancer or kidney failure, I need dialysis. But your everyday stuff is actually cheaper for me to go in and pay with cash.
Yeah. Yeah.
I think people are starting to realize that.
Yeah. Yeah. So we went through the same thing with our family too at one point in time too. So when I was transitioning, so when I was transitioning like out of the health insurance arena and going, okay, I'm going to go for this. I want to do different. I don't want to just work, with this one company. I want to do this with lots of companies. And we had to look at what did that look like? Because I always carried the insurance for us. And so we went for a period where we were paying for our own health insurance. And we knew that our son was going to have this surgery and that it was going to cost a lot of money within the next year or two. And so what was that going to look like for us? How much was that surgery going to cost? And what made sense for us? And this surgery cost, the hospital that he went to in excess of like $400,000 or $500,000. It wasn't something we could take on. But we did look at like, what did that care look like before he had to go in the hospital? And is it going to cost us $24,000 for health insurance? Is it worth it to pay for that care ourselves before? I mean, it's very expensive, but sometimes it's cheaper to pay for it yourself. And so as somebody who had health insurance for over 20 something years, and I have 3 children and a husband, and we went without health insurance, believe it or not, for six months. So then we were like, okay, we gotta do something different, because we knew what we needed to do for our son. But it was cheaper for us at that point in time. And you're gambling, right, to make sure or hope that nothing happens during that period. But people are worried about the things you said specifically, right? Or younger people don't go on health insurance a lot of times because they think they're not going to get sick. And people are doing that.
A lot of younger people in our world, hospice, we're seeing a lot of people who are coming up with colorectal cancer. And when I say younger, I mean like 35 to 45, 50-ish. We just put a guy on who's like 26 last week or a couple weeks ago. So we're seeing now this is much younger. The reason, though, is because when they're putting off these doctor visits and these screenings so many times that by the time they actually go get it, when this cancer is different because the symptoms don't really show as much until it's too late. But
I understand.
Generally speaking, they're going too late. So by the time they get there, it's stage 3, stage 4. What I've also been told from them is that they too are gambling. Like they're basically saying, I would rather not have insurance. And it's interesting to hear you say, as someone who worked in insurance, that you saved money by not having insurance. Yeah. And what does that mean for the everyday person? What would you suggest someone do that?
Well, so I wouldn't necessarily suggest somebody does that long term, right? And it also depends on what your income looks like, and how much you're bringing in, how much you have saved in case something does happen. Because when you do go to the hospital, I know self-pay can be cheaper sometimes than if you have health insurance. You know how that works as well too. So, but you are taking a gamble that something could happen. Would I recommend somebody go and not have health insurance for a long period of time unless you're very wealthy? No, I wouldn't recommend that. But with health insurance, it's like a car payment, not really a car payment, more like a house payment. It's something like you always have, right? And I think that like we're tied into like, oh, this is something that I always have. That's what we're told. I feel like, oh, you're always going to have health insurance. You always have to pay for it. I think there is a window of time where you can go, okay, maybe I don't have to have it for a period of time, depending on what your family's needs are. But making sure you're still going to the doctor, right? You're having your annual things like that where you're checking into just your basic healthcare needs, like, blood work, just making sure everything's okay. Where I do see like a really big change, more so than individual, is going to be on the employer health side of things, where employers are doing a lot more self-pay or self-funded groups than individuals. That's where I see the market's going to start to change. I think employers are afraid of that because they think like, oh my gosh, if somebody goes in the hospital and they have a heart attack, it's going to cost me $1 million. But at the end of the day, how many of your employees are really having a heart attack every year? How many employees are really going to the doctor? So I encourage people to look for alternative ways. It doesn't have to be just take the standard way of paying for things through an insurance company. Insurance companies offer self-funding for groups too. So you don't have to just take this book of goods we've always been sold. There's different ways to take care of yourself in that way too.
That's interesting. And so I will say, I don't see long-term, I don't see employers buying into that. Because to your point, like for me, it's like, would I buy into that? Well, what happens, to your point, if someone does get a heart attack, right? It's like, yeah, I might save, a few thousand a month, but long term, I don't know if that's a risk I'd be willing to take.
You have to be a certain size company for it to make sense for you, but in certain circumstances it can, yeah.
The average company in America is a small business though. So that's 500 employees or less roughly, right? I don't know if any of them would. Like that just seems like you're one thing from happening that you don't control to going out of business.
Yeah. So here's the thing about self-funding, though, that people don't always know. You think it's not like you're specifically paying for it by every single claim, right? So although I said like a heart attack claim might cost you like $500,000, it's really like an aggregate of claims. I can't get into like every single detail, but like it's an aggregate of claims over a period of time also. So if your employees are healthy, and then what you're going to pay is going to go down. Unlike a traditional like plan that you have set up with an insurance company, you're probably going to pay more the next year, even if everybody was healthy, right? Your insurance premiums typically go up. I it's very rare that I ever hear somebody say, oh, I mean, I can't remember when they've ever gone down. Okay. I can remember where they've stayed the same. But you can take a little more ownership for it in these situations. I've seen companies with employees less than $500 who've done it very successfully too. So there are opportunities out there where it does work.
I'll look into that. So you are now, I'm going to call you a consultant, a healthcare consultant. How do you help people? What kind of people do you help? What does that look like? How do you structure this? Kind of break it down for us for people who have companies or businesses and looking for help.
Yeah, absolutely. So I don't specifically work with the companies, but I know a lot of people that do and can help people with that kind of thing. But I specifically work with the insurance companies themselves. I work with medical practices and work with hospitals, networks, because I go in and I show them where we can make changes based on patient experiences that I've seen. And so what I usually do is do a lot of research on the organization themselves and share with them the really good things that I'm seeing and some of the things that I've seen in the public that need to change and present it and what it looks like. I specifically like to work with ones that both have the insurance side and the medical center side of it, because then, when you do own both sides of it, you're blind to it on one side and the other side, like this side's doing it wrong. Yeah. So I love to do that. But I think there's a lot of opportunity out there now to work with the individuals and the market and with employers. And there's some really great people in that space doing that too.
You also mentioned cost plus drugs, or you mentioned that Mark Cuban was doing some things. What do you love about what he's doing?
I love that he's like being a disruptor in the market, right? Making people think about things differently. I think people go to the pharmacy and they just think this is what I have to pay. And often, sometimes you go and your drug might cost less than what your copay is. And people don't talk about that often, right? So when you go in and your drug costs $4, okay, and your copay is $10, then they're going to tell you your copay is $10. And sometimes if you're at a good pharmacy, they're going to say, hey, you need to pay $4 because that's all it cost us for this medication. And then the individual gets really upset with the insurance company and doesn't understand why the insurance company is charging them the $10. It's not the insurance company taking the money, it's the pharmacy if they charge them the $10. But it's really even just the awareness that that's creating right now out there in the market, that you don't have to just pay whatever that copay is every single time. You can ask, is there, another alternative way to pay for it? So you don't have to just be tied into specifically what your insurance plan has for you.
See, I didn't know that. I thought if you went to the pharmacy and once they were notified that you had insurance, they had to charge you the insurance price.
No, you don't. And I even saw someone write something the other day on something, and it was on like Instagram or something that like they told me it was against the law. It's absolutely not against the law. I've had to get on the phone with people before and say, why don't you charge them the cost of the medication? It does not have to be that way. And this is just the person who's taking the information from you at the pharmacy who may not be trained appropriately, right? I've had these conversations with pharmacists too.
It's not malicious is what you're
yeah, it's not malicious. And at the end of the day, a lot of this goes back to what we talked about before. It's like the person being trained well and understanding what it is that they're supposed to do in the front lines.
A lot of pharmacies are going out of business.
Yeah,
a lot of mom and pop pharmacies are going. And I predicted that about 8 years ago when I first got in the hospital. I said, I don't see this. And the reason why I was struggling with them was because they could not deliver medications effectively. That was one of the biggest problems I saw. It wasn't about the pricing. It was literally the people who need medications that people don't realize are people who actually can't come get them for themselves all the time.
Right,
so if you can't physically get them, and that's why something like PillPack was so successful so fast.
Yes.
Amazon was able to come in and get it.
Yeah.
I've been looking at cost plus drugs. I love the idea. My only thing with that, and I said this publicly already, is I don't see how he'd almost have to buy a pharmacy in every state because every state has a license for pharmacy. And that's where I see the huge barrier to entry there. Like literally, there is. Is he going to actually, I think right now they're only in California or something like that. So, but I did tell him that, not personally, but I made a post about it. I didn't tell him personally. And I was like, there is a space for him, right? And I think that if he were to go to mom and pop nursing homes and partner with them and give them, because a lot of them are aging out anyway.
Yeah.
if they're even still open. And there's one in every state that he can get into. There's
Yeah.
literally that won't cost him a lot. And
Yeah.
I think that's his entryway into the market in a real way. But without that, I just feel like pharmacy is just such a tough one to go. Anything that requires you to have a license for every state is difficult.
Yeah. Yeah. It is very interesting and it is difficult. And I have a cousin who actually was a pharmacist for about 10 years and she just decided she didn't want to even do it anymore.
Yeah, I've seen that a lot too.
Yeah, and that's really sad too. And she worked for one of the larger ones that's on the market, but like she just felt like she was not doing the right thing. And I felt like, well, how could you not feel like you're doing the right thing, filling prescriptions? And she said, people are getting drugs that shouldn't be getting drugs. People are having things written for them that they don't need to have written for them. And she's like, and then I just have to feel it like everything's okay. And I don't feel like that's okay. And I thought, wow, I'm really proud of you for standing your ground and making that decision. Because I didn't expect for her to say something like that.
That's interesting. So I, again, am not a politician. I do not pick a side at all. I think both sides are right and wrong a lot of the time. That's my honest opinion.
Yeah.
One of the things that I have said that when people are criticizing insurance companies, to your point, a lot of this is built up them tired of companies giving them claims for things that people don't actually need.
Yes.
So to your cousin's point, you kind of got a point there, right? Like I'm with you, right? I kind of like, we blame insurance companies, right? Mm-hmm. They're pushing back. We're not going to fill this claim. We're not going to do that. But for so long, they feel like they've been taken advantage of. My question to you, though, is that not just a part of the business? Because when you say I'm pushing back on claims and there's just a level of efficacy there, I understand that. But what about the 1% of times where you push back on a claim and someone actually needed it?
Yeah, I totally get that. So I'll tell you on the insurance side of things, like in the state of Florida, there's more fraud in the state of Florida than there is anywhere else in the United States. There's more here where I am than anywhere else.
I can tell you why. And I can tell you why.
Yeah, there's a lot of reasons. So one reason I can tell you is that like I owned provider enrollment at one point in time, and we would have a doctor's office saying that they're opening an office at XYZ place. And then we would go, we actually had an office in Miami, even though that's the only place we had an office that was offsite at the time from corporate. But anyhow, it would be a parking lot. Okay. And so that's just one example. That's really right. But that's actually what would happen a lot, unfortunately, in Miami. And then there's the flip side of it, where you have individuals like my good friend Melissa, who worked for a doctor or a dermatologist, and she's a nurse practitioner. And she just said, I had to go work for a different nurse practitioner because he was billing a lot of fraudulent claims. I wasn't going to be involved with that. And I will have to report it, and I'm not going to do that. So, I've seen it. I've been on the phone with people who said, I didn't have this service done. Like, why did the doctor bill for this service? I didn't have it done. And I can count, so many times where that happened. But you're right. At the end of the day, what about the person who went and had the service and then their claim was denied and it had nothing to do with fraud, but maybe it was flagged as fraud?
Correct.
So that's where we have to be transparent about why things are happening like they are. And I think that's part of the problem, is there's not a lot of transparency. And so people have lost trust in some of the larger health insurance companies, even some of the smaller ones. I think they all get grouped in together a lot of times because it's like, oh, nobody is doing any of these things. But if people are actually transparent and said, this is what's happening, these are what our challenges are, then we would start to build more trust in organizations and see what's actually happening behind the front lines. But until we start to see more of that, the same thing's going to continue.
So you also understand certificate of need.
Yeah.
I believe, and I say things that people that are, if they're in the room, they always scratch their head. They put their heads down. They say, please don't say that. But certificate of need to me is the reason why you have the most fraud in most states. Yeah. And what I mean by that is because I'm going to take a nursing home, for instance, right? And you tell me, say, hey, I want to open a nursing home in, let's just call it Georgia, right? Mm-hmm. And I go to them and say, hey, I have the funds, I have the location, I have everything I need to open a nursing home. And you say, well, you have to go through a process where you prove that it's needed, which is essentially impossible, right?
Right.
Essentially impossible. And so it never happens. And so what happens next is you have all these other nursing homes that are protected by certificate of need, which lowers competition, which means they can essentially do what they want. And I'm not saying they're committing fraud, but I am saying that it is easier to do things when you cannot really be shut down.
Right.
And I think why is it that it's insurance companies, to me, which should be the number one backer of getting rid of certificate of need. If you get rid of things like where you can't open this, you will have better outcomes. And also you be able to streamline how you're paying these companies. To me, that's a no-brainer. But why is that so overlooked?
Yeah, I'm not sure why that's overlooked as much. Like, it doesn't seem like it necessarily gets the attention that it needs. And I think you drive home a couple really good points there that we should probably look at a little bit closer, but it definitely doesn't get the attention that it deserves. And, I think that there is possible revenue from that as well, like looking at it different. But I feel like that they are going to hone in on where they're going to make the most money, because at the end of the day, it's all about how I can make the most money. And then the other things are secondary to it. And I think that's probably where that lens or that framing is coming from, unfortunately.
Okay. I got you. So I do these all the time. It's rare that I learn something.
Oh,
it's rare where I'm like, that's interesting. I appreciate that. Yeah. And I was like, I really want to say that you have really taught me personally a lot. Particularly with this Medicare Part D and how the money works for that, right? And how they have to pay for not signing up. I have one final question for you before I open the floor for whatever you want to tell us. Yeah. Are you familiar with the doula story? The 2 doulas in the hospital that were kicked out of the room?
I just saw something about it today, but I didn't click on it. So tell me about it. Okay. I know what you're talking about, but I didn't click on it. I know what you're talking about.
And I can say this because we're not live. So I interviewed them Friday. Yeah. Right. And so they come in and they give me the story. And the story is someone reached out. There were 2 doulas and they were in a hospital. And while they were there, the mother's choice, patient choice, was under any circumstance, essentially, I just don't want a C-section. Unless I or the baby are going to literally pass away, I do not want a C-section.
Yeah, right. Okay.
And so they go in and they say, hey, now the nurses are coming in, doctors are coming in and saying, hey, we have to do this. The baby is breached. We don't have an option. We have to do a C-section. And the mother's saying, nope, I don't want it. I don't want it. And the doulas were then accused of giving her medical advice, but they're not clinically trained in medicine, which was the argument of the hospital. So they brought the police officers and everyone to kick them out. Come to find out, they only took the mother there because she was in so much pain. They were at the hotel or place not too far.
Right.
She didn't get pain medication for 5 hours. 5 hours. 5 hours. She didn't get pain medication. And they kicked them out because they said that they were giving bad advice to the patient. I looked at this from 2 ways, and I want to get your opinion.
Yeah.
So the first thing I did, I am a healthcare entrepreneur. So I'm just going to be very, very transparent. I'm very transparent in that on all my videos. I always look at the money. And I'm wondering to myself, as someone who has a child who ended up having, my son's mom ended up having a C-section. And I'm like, how much do they make for C-sections versus just having it the regular way, the more natural way, if you will?
Right.
I looked at that first. I'm just, and I don't mind saying that. It's the first thing I looked at. Then I went back and I looked at, well, wait a minute. How many people or how many times are we going to keep telling women what they should and shouldn't do? And right. what is the real backbone to this from an insurance standpoint? What is it that we're looking at? What can women expect from these type of occurrences? Because now, I don't know if you've also seen it, what is happening is that women are now being taken to court, live court, in the middle of having a baby, telling them they have to have a C-section or they're going to go to jail, essentially. What are we going to do to tell women that they're safe, that the insurance companies are, because to me, this is a clear way for the insurance to protect women. Say, hey, we actually don't want to pay for C-sections if they're dying. How can we protect women here? I feel like it's something that I believe in deeply. And I want to ask a woman, because I want men to stop telling women what to do. So what do you think we should do?
Yeah. So interestingly enough, my daughter had a baby. She's like 16 months old now, like a total blessing. And she wanted to have a baby like in a birthing center where they do the tub. And so when she was in the hospital, they weren't able to actually do that. And then, when she had this, so she was upset based on that too, and she really wanted to have it. And then she was really pushed for different vaccines, right? She was not going to do vaccines, and especially with the younger generation now. And she was nervous because she felt like this tension from the hospital themselves that like, oh, if I don't give my child the vaccine, how are they going to treat me? And so she ended up just giving her like the vitamin K shot. But then here in the end, she ended up with jaundice, which can be debated whether it came from the vitamin K shot or not. That there's a lot of theories behind that. But then she couldn't leave with the baby because the baby had jaundice, which could have came from the vitamin K shot. So she wants to leave with the baby. It's very low jaundice, but they're telling her if you leave with the baby, then we may have to call in Child Protective Services or the police.
Whew.
So, yeah. And so then we're like, as a parent, and I'm supposed to protect her, she's an adult. Like, that was very hard. Now, all 3 of my children were premature and I couldn't leave the hospital with them. And that is gut wrenching. Okay. And so I know what it felt like to not be able to leave the hospital with my child. And I never wanted her to have to go through something like that too. But then for them to make it feel like or seem like if we didn't follow the rules, then the police were going to come and make you follow the rules. So I do think there is a real opportunity for, people in, I don't know if the insurance company, if there's an opportunity for them to step in situations like that, but people tend to listen to the insurance companies, right? Because they're the ones that are making a lot of the decisions behind some of this stuff too. But my heart goes out to that woman and to those doulas because I have been on the receiving end of that with my own child. That was not a fun experience. We have to be an advocate for change. It's one more reason why, like, I'm so passionate behind all these things that are happening. It's because a lot of the power has gotten taken away, and how do we get it back, right? So it's something I'm definitely going to be looking into more.
How do we get it back?
How do we get it back? So we're vocal and we're not afraid to be vocal. So I would say that often people are afraid in the health insurance space. You've talked about this a little bit too, of being ostracized, or people aren't going to be accepting. People aren't going to want to talk to me because it's, I'm saying something that may not be in agreement. But what I've found more often than not, at the end of the day, like I've said before, is that people genuinely want to do the right and good thing. When you come in and share this information with them, we make connections with stories with people, right? So you hear somebody's story and like that's impactful, and sharing those stories is what helps like bridge the gap between like, how do we change that policy to something that actually is manageable and works for people. How we make those changes is sharing those stories. Because if we all just like soften our voice and don't say anything, then we're not going to see any changes at all.
Gotcha. Heather Lacy, I want to say thank you for coming. Again, I hardly ever learn anything, right? And this is one where I'm like, oh my God, we probably need to do a part 2. I'd be really interested in seeing how that works. Any last thing you want to leave the audience with? Anything that they should know? Anything we haven't touched on?
No, I really appreciated being on your show today. Thank you for having me on.
Thanks, Heather. Until next time, this was the Healthcare Henry Show, and look forward to hearing from you guys soon. Thanks.